Hello, everyone. I'm your digital host, Tatiana White, and welcome back to another episode of 48's digital series, This Month Matters. May is Mental Health Awareness Month, and today we'll be talking about a new resource now available right here in Huntsville, the Psychiatric Urgent Care of Huntsville. And so joining me today are the co-founders and physician assistants, Priya Patel and Julia Klug, to share more about this new facility. And so how are you both doing today?
Doing good. Thank you for having
Yes, I'm so excited to hear about this. I feel like this is such a unique experience or clinic to even be able to have here in Huntsville. And so can you guys just both share a little bit about your roles with it? I know you guys were both the co-founders of it, and what made you guys want to open it? Because I know this is kind of uncommon to have a psychiatric urgent care.
Yeah, absolutely. We realized that there's a huge need in the community for timely access is one of the biggest barriers there is in mental health care. And that's why we created the urgent care, because it can take weeks to months to get an appointment with a psychiatrist.
So I've worked in psychiatry ever since I graduated PA school. And so Dr. Kumar and I have worked together for quite a while. And I think one of the things I've seen over the years is so many people that have actually suffered for so much longer before they came to get help. And so starting the urgent care, we just hope it's a resource where people can come that same day. The second they get the motivation to get help, they have the ability to walk in and get treatment that same day.
Yes, that's awesome. And I love that because it does take a while sometimes to be able to get into a psychiatrist or even getting a referral or something as well. And so what makes this different than a regular urgent care and going to the ER or something, for example?
Yeah, absolutely. So when you come to the psychiatric urgent care, you're actually getting direct access to a psychiatrist that specializes in all the mental health disorders, and you're getting direct access at that time. So you walk in and fill out some paperwork, you see a psychiatrist, you get medication or therapy recommendations, and you're usually out within an hour.
Oh, that's awesome. Yeah. Wow, I love that. And I feel like that probably makes people feel a little bit better too, knowing that they can just walk in anytime they need to just to be able to get whatever help they need.
Yeah, and not all of these behavioral or emotional issues require hospitalization.
Right.
So they might need help that day, but not to the point where they need to be inpatient in a hospital. And there's a bunch of urgent cares here, but they specialize in mostly physical illnesses. So like Priya said, we specialize in psychiatry. So it just offers a different level of specialization.
Yeah, and I love that you said that because I love the saying where it's the way you go to a doctor for physical health, you should be able to just go for mental health. And so the fact that this is treated similar to how an urgent care physical is. And so why do you guys feel a mindset like that is important for people to keep in mind of the same way that they are easy to go to an urgent care for physical health to be able to go for mental?
Yeah, absolutely. So when you break your arm, you're not going to wait weeks to months to get seen. And that is the same thing with mental health. Mental health affects every aspect of your life, at home, work environment, everything. So you shouldn't have to wait weeks or months to be seen for your mental health.
Yeah, absolutely. And I love that you guys are kind of bridging that gap too for people, because I know sometimes people feel like they don't have resources or being able to just go and get the help they need right away, and they feel like they have to wait or go to the ER, and it might not even be to that point, but they feel okay, this is the only option available right now. So I love that you guys are able to do that. And what types of services do you guys offer for people, and what can somebody expect when they go visit for this?
Yeah, so a pretty wide variety. Severe anxiety, depression, mood swings, insomnia. People that have maybe just moved or in between providers and need medication refills, substance abuse, people that are actively using or have recently tried to become sober and need help, fitness for duty. So a lot of times people will take time off work for some sort of behavioral issues or emotional issues, and they need medical clearance to return to work, so we can do that for them. Emotional support animals.
Oh, yeah. Awesome. Okay.
Yeah, and one thing we're really excited about, and it kind of touches on what you and Priya were just talking about, is we are offering telemedicine now.
Okay.
So anyone in the state of Alabama is able to get same day, honestly, same hour help. And so whether you're here in Huntsville, whether you're down in, Dothan, Enterprise, Mobile, wherever you are, You can call us or log onto our website and book an appointment.
Okay.
And we have appointments, like I said, within the hour, and we can see you virtually and get you the medications and the help you need.
Yes, I feel like that's so perfect. 'Cause I know sometimes even just taking the step to walk into the clinic can be intimidating or scary for some people. So
Yeah.
I love that you guys offer that, and also for all of Alabama too. So, you know, even if they're not here in Huntsville, they can get a refill if they're in between doctors or whatever they may need. So,
Right,
yeah,
absolutely.
yes. And people can do walk-ins as well. Like, you don't have to book an appointment.
Correct.
Okay, yes. And what is like the age range as well? Like, can teens come, or like, do you have to get parent permission, or how does that work?
Yeah, we're seeing ages 8 and up.
Okay, awesome. Yes, and I love that because I feel like, you know, sometimes like younger kids, they kind of don't get the help they need sometimes because they're considered so young. And so the fact that you guys can see, you know, elementary school students or whatever age range to help.
Yeah, yeah. Adolescents would need a guardian or parent with
Right.
them, just, you know, for signing off and everything. But, you know, we can see any, like she said, ages 8 and up.
Yes, amazing. And what are some signs that somebody may be showing that they could benefit from going to this urgent care? And could this help people before they have like a bigger mental health episode?
Yeah, absolutely. You know, it can be anxiety, you're feeling on edge, panic attacks, or you're feeling down, depression, those kind of things. Trouble sleeping, trouble focusing. It could be even as simple as that you just don't feel right that day and it's been going on for a while, and you don't want to have to wait months to get in for something like that. So it doesn't have to be an absolute urgent situation, but we treat a wide variety of things.
Okay, awesome. And do you guys just provide short-term care, or like if people want to keep seeing you guys, can they keep coming, or how does that work?
Yeah, it is very much up to their discretion. We're never going to turn anybody away. So if they need to come back and see us, we are more than happy to continue treating them. But we've all been in this field for quite a while, and luckily have a lot of connections with therapists, other psychiatrists,
Right.
Inpatient facilities, so we can point people in whatever direction. And you know, we try to talk to them about what their insurance is, like what their financial situation is, and help point them in a direction that will work well for them long term.
Right, yes. And do you guys do like screenings or questioning? How do you guys kind of determine what works best for somebody and their needs?
Yeah, absolutely. So it's basically we're just having a conversation, and that's how we like to keep it. We want it to be a welcoming environment. You know, when we talk about mental health, there's a stigma around mental health, and our goal is to make it a comfortable situation where people can walk in and just have a conversation about what's going on. So it's not like you're going to be filling out a list of symptoms or anything. We're just going to have a conversation.
Yes.
Yeah.
And I feel like that will make people more comfortable too, just to be able to express what they're really going through. Because I know some people are even scared to express themselves, or thinking that they're going to get in trouble with work or something, especially if they work in a certain field and, you know, they might get flagged or something. So just knowing that they can have a conversation, it's confidential, and they can get private help, whatever they need. So,
Yeah. I think, like we've said over and over again, like limiting the barriers to care. And so we don't want you to have to come in and fill out a bunch of paperwork.
Yes.
And, you know, me and Priya will be the ones that you're seeing when you walk in, right? And then there's a couple other providers as well. But so it's just us. We sit down face to face. And I feel like we can relate to people quite a bit.
Yes, yeah, I can tell. Even just us sitting down, it's like you guys make everybody feel comfortable. So, and so, do patients need? I think you touched on it a little bit, but like insurance, or how do appointments work, or how does the payment, I guess, work if people need help or if they don't have insurance?
Yeah, so we are not accepting insurance. So there's one flat cash pay rate, but we can give you, it's called a super bill, basically the paperwork you need to file with your insurance, and a lot of times your insurance will reimburse you for that.
Good.
We are looking into starting to accept some insurances, so hopefully that's something we can provide going forward.
Okay, great. And why is Mental Health Awareness Month just so important for both of you guys, since you guys work in the mental health field, and like why is awareness just so important? And like you both said, breaking the stigma.
Yeah, absolutely. So, you know, when it comes to mental health, there is a big stigma around it. And that's the goal of Mental Health Awareness Month, is to bring awareness to that. And, you know, this is the month to check in on yourself or check in on a loved one that you know that might be struggling, and to know that help is here and it is available same day with us at Psychiatric Urgent Care.
Yeah.
Yes.
Yeah. I think we're about, like 20% of people suffer from some sort of mental health
Yeah.
issue. And in Alabama specifically, I know the suicide rates are higher than the national average. So I just think it affects so many people, and we need to stop turning a blind eye to it.
Yeah, and being able to just have like that readily available help, because sometimes people just need like a little bit of help, whether it's just like a
Absolutely.
small dosage of something to get them through every day, and they might not even know, but just going here can help them realize like they can find something that can help change their everyday life. So,
Right,
yeah.
and like knowing what they're going through is treatable.
Right,
People,
exactly.
when you get in
yes.
that state, you just feel so hopeless a lot of times. And so it's like, no, a lot of people deal with this. It's extremely treatable. It's just taking that step to get the help.
Right, exactly. And it can be like scary, but just knowing that you guys are just going to make it a relaxed environment for them, and knowing that they can just be like, okay, I'm going through this. I can get just something a little bit to just be able to get through. So,
Right.
Yes.
The office, it's in a house. Like,
Yes.
It's not even a very clinical environment.
Yes.
So it is. It's very relaxed.
I love that. And what is like one misconception that you guys still hear about like mental health that you guys are hoping that the psychiatric clinic can help kind of destigmatize for people? And what do you hope people understand with this new urgent care?
I guess I would say, and we kind of, I guess, just touched on this, but the fact that you're alone in it. You know, we see a lot of maybe women that struggle with like postpartum depression or anxiety, and that's a really common one that sticks out to me. That feel where people feel like I'm the only one that's ever felt this way, and sometimes they don't even reach out to their closest friends or family.
Yeah.
So I think that's what I would say is like you're definitely not alone.
Absolutely.
There's a lot of people walking in the grocery store with you that have probably felt the same way. And I think a lot of times the second people step foot in our office and talk to us, they just feel so relieved from knowing that they're not alone.
Yes. Yeah. And I think it's like scary because you can feel like you're alone, and like if it's not talked about as much, you do feel alone because it's like nobody else is talking about it, or like if you come off as like strong and all the time and people come to you for advice a lot of the time, people feel like I don't have room to be sad, or especially like moms too, like they have to be superhero to their children, and like it's like, you know, I can't show that I'm going through yeah, so it's good to know that you guys provide that space so people can know like I can freely feel whatever I'm feeling. So do you guys feel like there's still like a gap in mental health resources, and how do you guys hope that the urgent care can fill that gap for people?
Yeah, so the average wait time to get in with a psychiatrist here in North Alabama is 6 to 8 weeks. Like 6 to 8 weeks can make a huge difference in a person's life.
Right, yeah.
And so that's why we created Psychiatric Urgent Care of Huntsville, is to bridge that gap with access. So same day appointments are available for you to get the help that you need, and not 8 weeks from now.
Right, yes, because that can make a huge difference if you are having really bad anxiety or depression, and then you're told like, oh, you have to wait 8 weeks. You can feel really defeated at that point, and you know, deterred from getting the help you need.
Right,
So.
or if you've been on medication and you know don't have someone to prescribe it, you could go through withdrawal symptoms.
Yes,
there are some pretty serious side effects that can happen.
Yes. And what do you guys hope this urgent care will do for the Huntsville community, and honestly all of Alabama, since you guys are able to do telemedicine for Alabama?
Yeah, I mean, I think, you know, in Huntsville, we're privileged that we do have a lot of resources, but even 20, 30 minutes outside of here, there's a lot of very rural towns that don't have psychiatrists locally. So I hope that we can just be a resource for everyone that needs it, for them to get that quick care and get them to feeling better and functioning their best.
Yes. And I love especially something that just came in my mind is thinking about how this is like a military town, and so there's a lot of veterans that sometimes have trouble getting in with like the VA or anything like that. So even this being a source for like veterans and like people who like teachers or whoever may be going through like traumatic things, just working. So,
Yeah, that's a good point. And we are, you know, we extended our hours to offer some evening hours. And, you know, a lot of people that work, like, I think Priya just spoke with someone who was like, I have a very demanding career. Like, I could not make an appointment during 8 to 5 hours.
Right.
So hopefully this allows people to get in and get help.
Yes. And speaking of the times, like what are your guys' hours of operation, and just weekdays or weekends as well, or how are you guys open?
Yeah, we're open Monday through Friday, 8 a.m. to 6 p.m. And then on Saturday, we're open from 8 a.m. to 12 p.m.
Awesome. Okay.
Yeah, and if we see the demand, you know, we're always open to extending hours if we need to. So.
Yes. And is there any advice that you guys would give people who are scared to go, or they may feel like, if I go and maybe my job's going to find out or my family's going to find out? So just anything that you guys would give advice for to encourage people to go if they need to.
I mean, everything that happens in our office is confidential. I always say, like, we're not your mom or dad. We're not here to get you in trouble.
Yeah.
With anyone. So definitely don't let that be a barrier. And like, you're not alone. People have dealt with this, and we will definitely make you feel heard and welcome and get you on the right path.
Yes, yeah. And I think that helps a lot of people, because I know, like, that's just something some people are like, I've never done this before. I've never taken a step to, like, actually tell somebody what I'm feeling. And so just that worrying. And so it's good to know, like, it's confidential. They can just come in, have a conversation, and get whatever help they need.
Yeah,
So.
and we can, if people need a work excuse, like school excuse, we can obviously provide that for you. But that is never something that's reported
Right.
or disclosed without the patient's
Yes,
consent.
that's awesome. And then for anyone who may, be watching, or they need support for themselves or their loved ones, how can they connect with you all? Do you guys have social media, website? How can they book and everything?
Yeah, we are on social media. You can book directly through our website. There's a booking link there. You can call and make an appointment, or you can simply just walk in.
Yes, awesome. And is it just the Psychiatric Clinic of Huntsville for the website and social media?
Yeah, Psychiatric Urgent Care of Huntsville.
Okay.
Yeah, and the
Awesome.
website is psychurgentcarecenter.com.
Yeah.
Awesome.
Yeah.
Okay.
But if you Google us, we'll pop up.
Yeah.
Yeah, and don't feel like you have to make an appointment. Walk in, and we'll take
Yeah,
care of you.
absolutely.
Yes.
Yeah.
And then also for the telemedicine, that's for everybody, whether you live here in Huntsville or anywhere. Okay.
Yes,
Awesome.
absolutely. And so the telemedicine, they can call us and we can walk them through how to book the appointment, but we would have to go through we have a portal that we set
Okay.
them up on, so that way we can do the telemedicine that way.
Yes. Okay. Well, is there anything else you guys would like to add? Anything I might have missed that you guys want to share with everyone?
No, thank you for having us, and we're really excited to have this resource for our community and really help we bridge, that gap between access and care. Yeah.
Yes.
Thank you so much
Yeah.
for having us.
Yes, well, thank you both, and I love that you guys created this. I love anything that promotes mental health awareness, and I feel like this month and even throughout the whole year, mental health is just such an important thing, and it has a lot of stigma. So the fact that you guys created a resource where people can just walk in anytime and get the help they need is so amazing. So thank you guys for doing this for the community.
Absolutely.
Absolutely.
Yes, and thank you all for tuning into this episode of This Month Matters. As we recognize Mental Health Awareness Month this May, it's an important reminder that mental health is just as important as physical health, and it's okay to seek help, and you are not alone in anything that you're going through. And thank you all for tuning in, and I hope to see you guys for the next episode of This Month Matters. I hope you all have a great rest of your day.